Thank you so much, Pramodji, for giving me this opportunity to present about precision medicine, genetic solution available for the medicines and nutrition. And thank you all for joining in. I'm going to share my screen so we can start. Is my screen visible?
Yes, yes.
Okay. All right. If you have any question, you can stop me right there, or we can have a question answer session end of this presentation.
Sure.
So without any delay, I'm gonna start. So we're gonna talk about unlocking the power of genetics. Today in this cutting edge, this is the cutting edge technology about the precision. It's just the precision medicine and nutrition. It's been there. The researcher are doing the research, and it is available since more than a decade, but it was very expensive. And now, due to the new generation sequencing availability, this technology is available to us in a cheaper form. Right now, it is called, so the precision medicine is called pharmacogenomics, and short form is PGX, and precision nutrition is called nutrigenomics. Let me see. All right. Have you ever, or your loved ones, ever confused or frustrated by medications, or you think the antidepressants are not working, or people are getting side effects of the medications? If this sounds similar, or if this sounds familiar to you all, you are at the right place. 99.9% of our genetics are similar. So what makes us different? Only 0.1% in genetic variation makes us unique. It's only 0.1%, and that is responsible for our uniqueness, the differences in our hair color, skin color, the eye color, and also the way we respond to our medications, and the way we react, and the environment, food, and lifestyle react to our genetics. So what is pharmacogenomics? It is an aspect of precision medicine. It is the study of how genes affect person's response to a drug. So it's a combination of pharmacology and genomics. And pharmacology would focus on the medication's absorption, metabolism, distribution, and excretion. And then genomics, we all know that's our DNA, our innate genetic blueprint. Both of these sciences combined make the pharmacogenomics. So when doctor prescribes some medication, they take so many factors into account. Patient's age, race, gender, kidney function, liver function, and their diet, their smoking, alcohol use, all these factors they put into consideration. But the genetics is one of the missing puzzle piece in finding the drug response. And we will know in a few minutes. It can affect the clinical outcome, basically the efficacy and toxicity of the drug response. This is how the pharmacogenomics works. Basically, what this image is telling us that how we have this enzyme, we have the enzymes to metabolize the drug. So how effectively those enzymes are working in our body. So for example, if we are ultra rapid metabolizer so the enzymes, those are present to metabolize the drugs are present in the liver. we metabolize the medication. So if we have more amount of those enzymes present, we excrete out the medication so fast. Those medication, let me explain you in a easy way. So for example, there is a reaction, chemical reaction from A to B is happening. Okay. So from that, there is catalyzer needed, the enzymes needed from substance A to reach to the substance B. Now those enzymes, that depends on how much enzymes we have. So if we have the more copies of these enzymes, then we will excrete out drugs very fast, and we won't get the therapeutic effect of the drug. So we need increased dosage of the drug. When we have a normal amount of the enzymes available in our body, those reaction would happen normally. We would respond to the normal dosage of the drug. While in the poor metabolizer or intermediate metabolizer, we have less enzymes available. So so the medication will store in our body for longer period of time. And therefore we will need less medication dosage. And sometimes in ultra rapid and poor metabolizer, we need to change the medication. Please stop me if I'm going too fast or there's something that is not making sense. I will be happy to slow down. This
So,
is it's
so I have a simple question as in layman language. So what you're
yeah,
saying is if my metabolism is really fast, then if I'm taking any medication, it won't stay in the body for a longer time and it will exit out from the body, excrete from the body, and I won't have a better result of that medication. Is that what is the
right. So it's not the whole metabolism. So that depends on the medication that you're taking, because each medication metabolized by the different enzymes. For example, ibuprofen is metabolized by, I will say the name, but I don't know if you would understand. But if it's a CYP2C9, it's the enzyme that would be responsible to metabolize ibuprofen. But for the clopidogrel, that is antiplatelet, that would be different enzymes needed for the metabolism of that drug. So it's not just the general metabolism, but it's the metabolism of the particular enzyme that is responsible for different medications response, right?
understood? Yeah.
Okay. So what are the benefits of the pharmacogenomics? Our first priority is patient safety. And with this pharmacogenomics information, we would be able to gene interaction. So in this way, we would be able to know whether drug has a therapeutic effect, if the metabolizing enzymes working faster or slower, that way we would know. And we can optimize the drug dose. And in this way, we will reduce the adverse drug reaction. And adverse drug reactions are fourth leading cause of the death in the United States. And it is, according to the CDC, it says 1.3 million ER visits occur due to adverse events each year. Out of them, 350,000 people hospitalized after ER visits due to only adverse drug reactions. And it was researched that 90% of the patients that possess clinically actionable genetic variants. So we have like 3 billion genetic variants in our body, but not all of them are harmful or beneficial. But with the medication related, 90% of the patients we possess that the genetic variant that we can work upon. We can change the medication according to that variants. And one of the study done last year in UK, that was published in Lancet Prepare study, they demonstrated that dangerous, costly adverse effect reactions were reduced by 30% with the PGX guided prescribing. The second benefit of the pharmacogenomics is maximize treatment efficacy. So one size fits all approach is not good anymore. Now we know we have more information available. Trial and error, we can reduce trial and error with that. The cost savings, we can reduce the multiple visits to doctors and hospital readmissions, reduce lost days at work because we are having, we can have the proper medication available for our diagnosis. It works better. When it works better, we feel better, and there will be reduced loss of days of work, reduced lost days of work, and increase our efficiency. Uh,
Yeah.
it improves quality of life. There are more chances when we know our medication are adherent, are compatible with our genetics. There is more chances that we adhere to the therapy. And when we adhere to the therapy, it works better, and we get therapeutic effect. It reduces polypharmacy. Polypharmacy is like number of medications patients are taking. And so it can cause more drug-drug interaction. Uh, so we can reduce that by de-prescribing, and pharmacogenomics can be one of the tools to find out that de-prescribing, which medication would be good for the patient or not. Avoid prescribing cascade. I would give one example of that. Prescribing cascade means once we take one medication, for example, if we are taking naproxen for pain relief. Now, naproxen is a non-steroidal anti-inflammatory drug. For pain, we take it. It can raise the blood pressure. So after taking for longer period of time, maybe some people benefit, some people would find that they are more hypertensive. So they go to the doctor would prescribe, and consistently it is getting higher. So doctor would prescribe amlodipine. Now, because of the amlodipine, there is a side effect of amlodipine that can cause edema. So now patient goes to the doctor office and they can get the water pill to reduce the edema. So now you see, because of just the one medication, naproxen, you lead to the hypertensive medication and then to the water pill. We can avoid all this just simply knowing our genetic information that, okay, that medication won't work, then we don't take that medication, and we would be, and the adverse drug reaction would be reduced.
So I have a question here, Palakji.
Yeah.
So do you mean that as an individual, we could identify for myself what would be the correct medicine that can work for me from the pharmacogenetics technology? Is that correct?
Yes. I would go further in further slides that there are not all the medications are affect, since research is still going on, and not all the medications have the pharmacogenomic information, but most of the medication has. So I'll go on one of the slide, I will go over which drug class would get more benefit with it. Yeah, so the cost benefit for the PGX, one of the study conducted in community pharmacy found that with the PGX testing, the healthcare cost reduced by $2,000 per patient. The other study says $5,000 per patient over a year, and reduce overall healthcare cost by 22%. So it reduced hospitalization, decreased medication cost to overall healthcare, not only for patient, but overall healthcare costs can be decreased. And most important, that it would improve patient outcomes. So this is the disease states benefited by pharmacogenomics. Cardiovascular disease. In cardiovascular disease, also not all the medications are considered into PGX testing. Metoprolol, for example, is one of the candidate for this test. For psychiatry, there is more research available for psychiatric medication. Now, wide class range of this drug for this disease state are benefited by the PGX testing. Cancer, of course, FDA also has a recommendation for some medications that PGX testing is necessary before prescribing the medication. And pain management, definitely, like, for example, codeine or tramadol, those medications are affected by PGX. We would know the benefit of the, if that medication would be benefited by the PGX or not. Yeah. Any question here? I'm kind of going faster, I think. Any question here?
Mm.
Yeah, if I remember something else, I would definitely go over, but uh, psychiatric and pain management, those two are main concern for the main benefited disease states by the PGX.
Is there any research that gives that, based on the ER, research, that what type of medications till now are causing more as a side effects, or it doesn't matter, every medication creates a side effect?
But truly speaking, every medication causes side effect, but it depends how you react. Because of your genetic variant, some people get more side effects, some people won't get any side effect. And if you have noticed, maybe you have heard some cases also, same medication cause more side effect to some patients and some not. Some will be fine with that. For cancer patients, all medication cause the side effects, more side effects, like dangerous side effects. Uh, with the genetic variant, some people can die even with one dose. So that's why FDA has in their labeling that PGX testing is required before they prescribe the medication. Did I answer your question?
Yeah.
Okay. So here is just one diagram for non-personalized medicine and personalized medication. So what we have been doing is we were going to the doctor office or hospital, and blood test was performed and diagnosis was done. And based on that, we would prescribe medication. And some people respond well, some people don't. But now, with the personalized medication, along with the blood test, we have the genetic information. And with that genetic information, that medication is prescribed for that disease state. And most likely that would benefit to the patient. It's nothing is 100%, but this is 99% effective in this way when we use the genetic testing with the blood test. So who can get benefit? People who is worrying about side effects, who is experiencing side effects or having adverse drug reactions. They are on multiple medications or comorbidities. People without liver transplant, because these enzymes are present in the liver. So people who has liver transplant or liver diseases like cirrhosis, they won't get benefit from this PGX test, because the enzymes will be altered and we won't get the right result. And anyone greater than 2 years of age interested in learning more about this. Why do we have to be proactive? So these tests are in the FDA label. As I said, that they are not saying that we should use this. Everyone should test before any kind of medication. They are just mentioning for certain medication, if doctor is going to prescribe, people need to do the testing. However, I believe that test results are available if we have the results in our hand. Test results are available readily when in need, because this takes like 3 to 4 weeks to get the result. So we don't have to wait for the result and treatment. Second thing, pregnancy can alter the enzyme. Alcohol and smoking and diseases such as inflammatory bowel disease, cancer, some diet, environment also can change the phenotype of the patient. So the way the gene express it can be changed by the disease state. That does not mean that even though we are taking so many, if somebody is taking so many medications or have already all this suffering from the diseases, they cannot have this test. They definitely can have this test uh, because that will be their baseline information. But people who is healthy right now, if they do that test, then that would be the real baseline information we have for our genetic uh, our genetics. So it would be wise to know our genetic blueprint and wise to know what factors also affecting those genetics so we can make informed decisions. Uh, so just pharmacogenomic testing available in single panel. So means just the one gene. Um, for example, for clopidogrel, it's CYP2C19. So you would just do the test for one gene only. And the whole panel is also available. Single gene panel is more precise, may be covered by insurance, we don't know. Test result is limited to the test gene. While pharmacogenomic panel, excuse me, we have more covered genes. And one gene is not only responsible for one medication. One gene is responsible for different medications as well. So we would have multiple gene and multiple drugs available with the panel. Also, multiple genes are responsible for one medication as well. So if we just do one single gene panel, then we won't be able to know the other genes that are affecting that medication's metabolism. The panel cost may not be covered by the insurance, but it's affordable. It's a best study, and the panel also contain best studied and important genes that has a clinical relevance and a clinical utility to it. So
Palak ji, Milin here. Can I ask a question?
yeah, sure.
So, if I understand correctly, the pharmacogenomic panel, which covers multiple gene, is that used in more generic drugs?
Yes.
If it goes with multiple drugs, am I following it correctly?
Right. Yes. So more generic drugs means you would find more information for the psychiatric drugs because right now we have more research available for psychiatric drugs than pain medication and then cardiovascular medications. Cancer medications also is there. Uh, but you would find more information for all generic drugs for the psychiatric medications. And one more thing I wanted to add, I also put down here, there is no standardization of panels. So one lab test offer one set of genes, the other lab would offer another set of genes. But we need to know if person is taking particular medication, we need to know which gene is responsible for that. And then based on that, we need to select the panel and select the laboratory based on the medication, based on our based on our medication interest, basically,
Okay.
what
And then
medication we are taking.
I have a follow-up. So, uh, as a common person or a patient, right?
Right.
Like, who takes this decision? Like, is it doctors? Like, how do they know? Do they
So
go with a single gene panel test or more generic one?
So single gene panel, I would, who takes the decision? Usually doctors, when you go to the doctor, usually doctor would tell you. Right now, the situation is that not many doctors are aware of that. This is fairly new, and anyone who is aware of that, they are not trying to do that because it's a lot of things involved in it. So many, it's like 30-40 pages report. And even though the report would say that this medication you should avoid, this medication you should take, it's not that simple because I'm going to explain that in the next few slides. Phenoconversion happens. That means our diet, lifestyle, other medications would also affect to these genes. And there are so many barriers to this implementation. And that is why my main concern is people would need to know that these tests are available, and uh, laboratories are offering Quest, LabCorp. They do offer the test. You need to go to the doctor office and you need to convince the doctor that really you wanted to do it. I don't know the response you would get from the doctor. But for right now, I didn't get any good response. As of yet, I did not get any good response from the doctor to implement this, even though I offered that I would do the back end work. But still, they are a little bit hesitant because of the not widespread use, and there are so many educational barriers. Uh, peop, the patient understanding barriers. So many factors involved. So hopefully one day it would be useful. I always consider this, I know I'm a little bit diverting, but there was a blood test, back in the days, blood, when we were giving the blood,
Mhm.
people would give any blood without testing the blood groups. It was long, long, long time ago. Now we would know that specific blood group you have, you can get only that blood infusion. How so that in the future it would be same like this, that now we have this information, we would know for sure that now this medication would be effective to me. Why would I take the other one that is not effective, right? So it's more personalized, but it's little bit, it's gonna take some time for this. um
So there's a question here again, Palakji.
yeah.
That can we know the gene responsible for a very common, problem in today's life is diabetics, thyroid, cholesterol. These are, I think, everyone has one or the other.
Yeah.
So are there any which genes are responsible? And then if after doing this pharmacogenomic test, can we find out that, okay, which medication would work for better for, personalized kind of thing?
Right. So depending on your disease state, this is only for the medication. So it won't give you that information, what is causing, which gene is causing the problem. That would be in nutrigenomics that we would cover in the next half. But again, this would give you only the information about the medication, which medication would be better for you. If we have a proper research about that medication. So as I said, for psychiatric medication and cardiovascular medication, thyroid medication does not have this, we don't have the research available. Metformin, recently the research came out, but still it's in the process that people can use it for that. Um, so yeah, not every single drug has that information available as of yet, as of now. Um, as I was saying, that conversion, that the report will be like 30, 40 pages long, and you would get the information, you don't take this medication and this medication will be effective. However, this conversion happens means two drugs can interact with each other and change the function of that enzyme. For example, this codeine is a pro drug, means it's an inactive drug. When we are taking Tylenol number 3, acetaminophen with codeine for pain, sometimes then dentists prescribe that medication for pain. It has to turn into morphine to have that pain reducing effect, right? And in order to convert that, we need CYP2D6 enzymes. Now, if we have these enzymes in a normal amount, we are fine. We will have good amount of response. However, if we are taking fluoxetine, that is one of the psychiatric medication that is used in depression. If we are taking this medication, that medication inhibits that enzyme. So what happens, even though you are normal metabolizer, if you are metabolizing that medication properly, but since you have taken this other medication, so this codeine is not going to convert into morphine, or it will convert into morphine in a lesser amount, depending on the inhibition happens. On the other hand, when you are taking prednisone, it will increase the conversion of the codeine to morphine. So
So there is another
on
question.
one side, we will get toxicity.
Good.
Yeah,
No, good. I'll
I'm
ask the
sorry.
question at the end.
No, go ahead.
So Rajivji is asking question, are we going back to personalized medication like in Ayurveda, like many years in India, where Ayurveda is very personalized?
I know. I always refer this one to Ayurveda because Ayurveda is personalized. I always think that Ayurveda is personalized. Uh, Ayurveda is different. That's a herbal medication. All herbs we are using. Uh, by the chemical composition is made the similar to the herbs. But I don't know if we are going back to Ayurveda, but Ayurveda, I do agree it is effective. And this is allopathy that we have right now, whatever the health system we have. I feel like this will be beneficial to know our genetic blueprint and work towards it.
Yeah. So Umar, who also raised the hand. So you have any question, Umar, here?
Yeah, Palak, I just have a small question basically. If someone is taking some drug for a long time and he has become now the tolerant of that drug, how can PGX test or else
I
another
can't hear
test?
you, Umarji.
Sorry, can you hear me? Hello,
Yeah,
am I
we
audible?
hear you. I think, yeah, go ahead. I
Am I
think,
audible, sir?
yes,
Yeah,
yes.
yeah.
Yeah. So my question is basically, if
Yeah,
someone,
you're breaking. Your voice is breaking. Can't hear properly.
yeah, just give me a minute. I will just use a earphone. Am I audible now?
Yeah.
Hello. Yeah.
Yeah.
So question is basically if someone has been taking some drug for a long time and now he has become tolerant and is now ineffective, it's not working that much as it was working before some drug. So how can this PGX test or the gene single gene panel test help that person?
So I would say if that medication was effective before and now it's not effective, something must have changed in his diet or environment or lifestyle that is blocking that enzymes to work, that medication to work. Basically, the chemical reaction should happen the way the chemical reaction should happen. It's not happening in his body. So something is blocking. So we need to find out what is blocking. Uh, Depending on the what medication is that, it's very I'm just giving, it's very generic. I'm giving very generic answer, but I know you're asking specific one, but it wouldn't it for me it won't be possible to give you specific answer because I don't know the medication.
Yeah, so basically it's regarding my mom. She's allergic to this pollen. Yeah, allergic to pollen, and she has this reaction to it. She gets the sneezing and she has itchy eyes. So she used to take this drug. It's called the levostrizine and montelukast. It was prescribed by doctor. So before it was working very good and effectively. Now as she's taking, she has to take it because else she gets the reaction during these pollen times. So I have seen over the times it was working very good, but now it's bit ineffective, and we
Right.
have to try the different types of this drug. Yeah.
Right, right. Sometimes that happens. Again, it depends on the environment and something is blocking uh, the diet that she has been taking. We're gonna go over that presentation. The other, I'm gonna go further into that. faster because
Your voice is breaking.
that is a big response. So that could have happened. Probably the diet, lifestyle, and maybe the receptors or enzymes are very saturated. So something is blocking in her body. So we need to, maybe she's not detoxifying properly. And it's just that chemical stays in her body for longer period of time. And that is causing that reaction, that medication is not working. I'm gonna go over with that. I know I have that the example available in next few slides. So
Yeah.
let me move forward. I'm gonna go very fast with this case, just to know, to have you guys an idea how does this properly work. So this patient has a hypertension and lisinopril he was taking for that, and he had a knee replacement surgery. So in the in inpatient he was prescribed codeine, and his pain score was 9 out of 10. While in the post-discharge, he was prescribed tramadol for pain, and his pain was still 9 out of 10, 9 out of 10, and his pain was not in control because the enzymes needed for that medication conversion, that is, he was poor metabolizer. Now, this codeine is a prodrug. Prodrug means it needed to be get activated. So you take that medication, it's not active in the body yet. With that enzyme, it becomes active and gives that pain relief effect. But since you don't have this, he doesn't have these enzymes, or the enzymes he has, but it's working less. So that's why he's not getting the pain relief. So now doctor wants him to use the NSAIDs, the non-steroidal anti-inflammatory drugs. Now he's also metabolizing less. He has less of those enzymes available. So now it's a choice, like which NSAIDs that we would choose. So now it goes back to the half-life of the drug. The half-life half-life is that is the body reaches to its maximum concentration, half of the maximum concentration in that time. That is the half-life. It cleared from the body faster. So in this case, since that person has the poor metabolism, we would use Celebrex, ibuprofen, or flurbiprofen, because then otherwise meloxicam or peroxicam would stay in his body for longer period of time and give toxicity. I'm going to go a little faster here. I'm sorry if I just give me some, you can ask me question, because I just wanted to cover the other half. And a lot of your questions will be answered over there too. So because of these two poor metabolizing enzymes, we have to choose which medication would work in this patient. Okay, so that was the pharmacogenomics. I'm gonna switch gears to personalized nutrition. Personalized nutrition is the diet addressed to the individual based on his or her genotype or nutritional requirement based on age and gender. So right now, there are so many choices for the supplements available. We all take some kind of supplements. It's overwhelming. Sorry about that, this typo, supplement choice, overwhelming choices of the supplements. Maybe we are consuming in high amounts. Supplement has a physiological and financial impact on our lives too. So let's see how we are making right decision for our supplements or not. Nutrigenomics is the study of the relationship between the nutrition and the gene expression. So what does this, nutrigenomics called NGX in a short form. So it examines the unique genetics and biochemical makeup for everyone to guide more precise strategies for the prevention of the diseases. So the pharmacogenomics was based on the treatment of the disease, and this one, nutrigenomics, is on the prevention of the disease. And I believe that we should know both these modalities in order to make our life better. So the goal of the nutrigenomics is to provide nutritional support on the basis of the genetic makeup that impact patient's gene, that impact on the gene expression, so the body can start healing itself in the most effective way it's possible. And what do I mean by gene expression? Our genetics is not our destiny. We used to think that genetics are our destiny. This is all we have. We cannot do anything. But no, our genetics is not our destiny. We can not change the genetic sequence, but we can change the way the genes express in our body. And that is changed by the environmental factors, our diet and lifestyle. That is called epigenetics. So we have the same genetic information present in each cell. So liver cell has the same DNA information, and the brain cells also has the same DNA information. But when the alcohol consumption happens, liver cells know that these enzymes needs to release in order to metabolize alcohol. But brain cells do not produce that enzyme, just the liver cells, and that is called gene expression. The diet influence on the gene present in that tissue. So the gene turns on and off based on the nutrition and the environment. So here it's a diet, food and diet as nutrients, and all the bioactive compounds in the diet can affect the metabolism and cell signaling. So different metabolic pathways of the diets can metabolize in different pathways, and the biological compounds that diet contains, not vitamins and nutrients, those are flavonoids and anthocyanins, all these different biological compounds, those trigger the signals in a way that gene can turn on and off. And here in this picture, in this image, gene expression, because of all this, the nutrients and diet constituents, the gene expression in the liver cells, the first is the muscle cells. Second is the liver. Third one is the pancreatic cells. The fourth one is the brain, hypothalamus, and fifth one is adipose tissue, the fat cells. All those combined effect on different tissues, different organs, bring the glucose homeostasis. It means it keeps glucose in balance. So that's why we know that doctor tells us to do exercise. Why? Because when you do the exercise, your muscles are storing some glucose in it. So there will be less amount of the glucose in the blood. So that's why it's the muscle cells, liver cells. Why liver cells and what do you call the fat cells? Why doctor tells us to use less saturated fat? Because all that affects to our gene expression and basically the glucose homeostasis. So keeps glucose in balance. I'm gonna give you example of this housekeeping genes. So what happens is when we have genes which keeps the biochemical process in place, right? We have genes for DNA repair. Every day DNA repair happens. When we sleep, DNA repair happens at night. And that's why it's also always recommended to sleep early, wake up early, because during those periods, our body is repairing, and we feel good about it. And that's why if you have if we are like for a couple of days, we don't have a good sleep, we know what happens. So the housekeeping genes are altered. When the housekeeping genes are altered, we can support it by diet and lifestyle. So once we know that information, we can take informed choices, more, we can take more better choices for our lifestyle. For example, this gene, MTHFR, it's called MTHFR C667 polymorphism, that is useful for methylation. And methylation is a chemical process that would be needed for DNA repair. Now, if we have the SNP, if we have the polymorphism that in that gene, that means that gene is not working properly. The function is slowing down. That gene's function is slowing down, so we cannot get the DNA repair. So now what can we do about it? So we can support it by diet and lifestyle choices. So in this case, with this enzyme, if this is slower working, then we can use folate and vitamin B, sorry, fit B12, sorry about that. It's vitamin B12. So we can use vitamin B12 and folate and SAMe supplementation. We all know the SAMe supplementation available over the counter, right? Yeah, we can support it by that. But we can do that only when we know that we have that genes available. When we know that that polymorphism is available, then and then we can use SAMe. Some people I know have been using SAMe without knowing, but excess or less amount of all these supplements can cause the problem. Even excess of vitamin B12, one of the research was saying that increase the risk of cancer. Still more research is needed, but that's what one of the research says. So what are the benefits of this nutrigenomics test? This is very wide topic. I'm trying to give you just the overview. So please feel free to ask me any question. I'm gonna try to explain it in a better way because we have a limited time. So the benefits of the nutrigenomics, it's basically, it will, with that test, we would know we are vulnerable to the deficiency. For example, if we are absorbing that nutrients in a proper way, we are transporting nutrients to the cell in a proper way, or the utilization of those vitamins or nutrients by the cell. So all these steps are needed, we needed to know. So sometimes we absorb the nutrients properly, but that absorption won't be effective if the cells do not get that nutrients in order to perform the function. Then there won't be any use. You won't get any benefit from that nutrient. So we need to know what is that causing disruption. And based on this, we can take proper actions. Providing professional supplements. Professionals can provide this proper supplements. For example, quercetin. During COVID times, we all knew that quercetin was very helpful. It's an antioxidant, and everyone should take that. That was helpful. However, there is a research says patient with certain genetic variant should avoid that quercetin. So if we would have not known that information, our genetic blueprint, then maybe we might be taking all these supplements thinking that, okay, this might be helpful to us, but really it's causing more distress to our system. We appreciate genetic variation. For example, lactose intolerant, histamine intolerant, food intolerance. Lactose intolerant, we all know, we know the lactase enzyme is available, right? Why we are avoiding dairy products? Because some people who are lactose intolerant, they're avoiding dairy product, or if they are taking dairy product, they use the lactase enzyme to facilitate the metabolism. And histamine intolerant, Umar, when you asked the question about your mom, this might be the case. So histamine is the chemical that needed to flush out the allergens from your body. Now, once it flushes out, that histamine comes into normal amount, like goes back to its place. For example, if we have in our home, we have everything arranged. If we need something, we take it out, and then once the thing is done, if we are cooking, we are taking out the spices and put back when it's not needed. So same way, histamine is when histamine is needed, our body will secrete, and then it will excrete out from our system. With the patients with the intolerance, histamine intolerance, what happens is it's not degrading from their body properly. So their enzymes are not functioning well. So in that case, we have to support that patient with the some enzymes or some diet or proper diet, because some diet also are rich in histamine. That would add more problems to the situation. So Umar, as you have said, your mom was better tolerating that medication before, but now she's not. I would ask you to go over her diet as well. If she's eating something, for example, avocado can are rich in histamine. Some people cannot tolerate avocado a lot. So eggs also. So there are so many things that we need to check what food is causing more problems to us.
Yeah, that does make sense. Basically, these medicines which we are given to him are they basically reduce this histamine, right? They
uh,
block this. The
right.
medicine.
But we have
Yeah,
to no, because histamine, we have to, if it's too much histamine, then yes, there would be a problem. That's why we need to give that medication, definitely. But then histamine releases, and then it should not be there in a longer period of time. When we get the so much allergic response, that chemical is not coming out from our system very well, and that's why we are giving that cetirizine or levocetirizine or claritin to that is histamine blocker. So basically,
mm,
we are blocking more histamine to stay in our body, because once it goes to everywhere else, it reaches to the body, it causes more problems, because basically it's not coming out. It is needed, but then in a smaller amount it's needed. When the system cannot recognize the difference, when to stop, then it would be a problem, and that's why we have these symptoms. So the medication is needed, but the food and the environment she is in sometimes can be the cause of the intolerance. Sometimes some people comes from the India, and they start having all these symptoms, and then when they go back, they are completely fine. It's basically their immune system is reacting to the allergens in
So
the
we are on the
environment.
time bound a little bit. We need to move faster.
Yes, this is my last. So the precautionary with this nutrigenomics, precautionary steps can be taken. For example, if we have iron overload, there is one gene that is HFE can cause the iron saturation. So once iron is a metal, and it's a very it can oxidize. If it can saturate in our body a lot, it can cause more problems. So if patient has these kind of genes available, then the iron can reach to the different tissues and cause different symptoms. Not everyone will get the same symptoms, but different symptoms will be seen on different patients. So once we know that we have this gene present, we can take precautionary steps uh, to have the blood test every year for the full iron profile. and we can minimize the iron intake, depending if the blood test is how good is the blood test. So yeah, there are so many things with the nutrigenomics, for sure. There is a lot to dig in. And these are I'm done. I hope you guys understood it better. There are so much information, but yeah, thank you so much for your time. I really appreciate that.
So thank you, Palak ji, for this session was really, really, really helpful and is required right now. And those who are not aware, last year, I think in 2021, we had like a 4 sessions conducted by Dr. Chopde, who is a MD PhD in genetics. So you can find out all those videos on our channel. The 3 sessions were on a genetics, and the last session was on a epigenetics, expression of the genes, and that's where I learned all this terminology. But this PGX and nitrogenomics is the new thing, and thank you for bringing this valuable information to us, Palakji. There is a one question from Rajuji, which we will take the last question. So what he's asking is, can PGX testing help in making decision for altering genes to make the medications more effective? Example, epigenetics.
Sorry, for altering genes?
Yeah, to make the
Uh,
medication more effective.
no. No, PGX won't give that information. PGX simply give the information about the metabolizing enzymes. Those are only present in the liver. Basically both of these PGX and NGX is related to the detoxification. So phase 1 detoxification is PGX, phase 2 detoxification is NGX. So we need to know, we need to have both genes working in a proper amount to get rid of the excess, get rid of the toxins from our body. And toxins comes from the medications as well. So that's uh, so yeah, but no, the question that you are asking, the answer is no for that.
Thank you very much. And some of the users who joined send me a personal message of asking your contact information. So I'll share your email address with them. Is that okay?
Yeah, you can share the email address and my phone number as
Oh,
well.
no.
It's fine.
As well. Okay.
Yeah.
Fine.
Okay.
This was
Thank you.
very knowledgeable. Yeah, go ahead. Sorry.
No, I was just saying thank you so much, everyone, for the patience, and I hope I did well to help you understand. It's just a lot of information in here, and I connected 2 topics into one session, so it's quite overwhelming as well. But I hope you get some of the idea about the newest technology available in the market.
Yeah, absolutely. Yeah, absolutely. We are aware. So is this tests are done through blood test or something else? Just
No, the tests are done through the saliva. So
okay.
it's a non-invasive test. It's just the saliva buccal test. It's like when we are doing the COVID test to the nostril, but this is the buccal test in the chicks. That's all. Let's just send the sample to the laboratory, and then the result will show up in 3 to 4 weeks.
So thank you everyone for joining the call on Saturday morning, early morning. I know we all have to go for all groceries and everything, but taking a time out for this um, on Saturday morning was thanks for all that, and thank you Palakji for spending a time and educating us